we're focusing in on a way you can live life clearer. LASIK is the most common type of refractive surgery. Every year, more than 4 million Americans choose to have LASIK surgery. Therefore, when you're considering LASIK, one of the most important moments is choosing your surgeon. Well, today we have Dr. Dishler, who has personally performed 51,000 LASIK procedures and was the first surgeon in Colorado to perform LASIK. As seen in Forbes magazine for a second year in a row, Dr. Dishler was voted one of America's top 10 vision correction specialists in a nationwide survey of eye surgeons. He's also a member of trusted LASIK surgeons who estimate Dr. Dishler among an elite circle comprising the top 1% of LASIK eye surgeons in the United States. In 2007, he was the first in North America and remains the only surgeon in Colorado to offer the Zeiss VisuMax femtosecond laser, the most advanced 100% all-laser flat maker, and the Zeiss Mil 80 laser, a true pioneer in a LASIK. Dr. Dishler is the most experienced all-laser LASIK surgeon in Denver and the entire state of Colorado with over 15,000 procedures. He joins us now with Sember Anderson, one of his patients who's also a nanny. Nice to see you.
Nice to see you, Denise.
So, Dr. Dishler, I said a lot there, but I think...
And I have to give you credit.
Yes.
You pronounced all those words right. It was great.
Femtosecond laser.
Right.
Yeah, and I always learn with you being on the show, but I think the one thing that's very impressive and stands out, and I want you to tell us more about yourself, is the top 1% of LASIK surgeons. And in Forbes magazine, again.
Yeah, isn't that great? I know, well, it's really nice to be recognized that way.
Well, you're obviously doing something right, that's for sure.
Thank you.
Sember, how did you decide to go to Dr. Dishler?
I found Dr. Dishler. My family actually did the research. My sister and my mom both picked Dr. Dishler because he was one of the best that they had found, and they had great results and absolutely loved it, so I followed right along after them.
And being a nanny, it's important that you're able to see everything correctly, right?
Yeah, everything I do, it's important to see. I'm a yoga instructor as well, nutrition. I do a lot of golf and sports, and it just makes a world of difference to be able to see.
Yeah. And do you remember what your eyesight was like before the surgery and how your surgery went?
Yeah, my eyesight was very bad. If I didn't have contacts or glasses, I couldn't see you from a distance. You'd be blurry, and I couldn't drive without anything. Waking up in the morning, I obviously couldn't see. So after the surgery was great. I didn't feel a thing. It was completely painless, very comfortable. It was actually more of a neat experience if you just embrace it versus being kind of afraid of it. And it was really cool. And afterwards, I can see perfectly. I can wake up in the morning and see. I can drive at night and see better. My eyes actually don't get as dry as they used to.
How's your golf game now? Has
Better?
it improved?
No.
Yeah, you got to be able to
back
see
and
that,
forth.
right? So, Dr. Dishler, I think when a person wants to, when they want to choose LASIK, they want to know what to expect because sometimes it can be a little bit of a nerve-wracking experience.
Right.
So you discussed the data that your center offers.
Right. Well, this is something that we think we offer that a lot of other centers don't necessarily offer, where we have looked at our actual results. And with that, we've looked at what our results are for LASIK, which is the most common procedure we do, which is well over 90% of our procedures. We also do some PRK, which is, for some people that can't have LASIK, we do PRK, which is a surface treatment, and those people do almost as well as the LASIK patients. But the important thing, and here's the data right here, you can see 2020 is considered perfect, and we've had overall, and this is a lot of people that have bad prescriptions, we have close to like 96% seeing 2020. This is very recent data. This is looking at our over 1,000 eyes from 2010, the first part of 2010. 100% end up better than 2030, and even a pretty good proportion end up 2015. What we're most interested in is seeing how many people need to have a retreatment, because a lot of people ask that, and that's less than 0.5%. So we have this very advanced technology, all blade-free LASIK. We try to make the experience very comfortable for patients. But the thing that's unique, and I want to explain, is that we actually track our results. We don't just have people come in and say, oh yeah, we do great, you'll do fine. We have a grid that we can have people come in and we can show them, okay, this is your prescription to start with, and this is historically how well we have done with patients in your range. And for most people, it's very close to 100% of chance that they'll achieve 20/20 vision with just one procedure. So that's something that's really, I think people should, from a patient education standpoint, people should be asking that of their doctors. Well, what for people in my exact situation, what's the chances I'm going to do well?
Well, and I think that speaks volumes for you and your company that you actually follow and track your patient success. You don't say, okay, see you later, some other time.
Right.
So you can actually take this graphic and these numbers and put them together and know the success that you have. What other factors actually come into play here to make sure that the client has a great, successful surgery?
Yeah, well, there's so many things. I mean, first of all, we have to make it a comfortable environment. We have to make things go well for patients. But we also look at different types of things like the diagnostic equipment that we use to evaluate the patients. We also look at the room temperature. We have a certified surgery center. We keep the temperature, the humidity controlled. We do things in a very precise way. Part of the reason, I think, is because we have been involved in so many FDA studies. We've been a chief investigator for various studies, and so we're used to doing things in a very methodical way. And we were the first center to do LASIK in Colorado, the first center to do all blade-free LASIK. And we're actually the only center that offers the Zeiss technology, which you're seeing here, the Zeiss diagnostic technology, as well as the therapeutic technology with the lasers. You know, a lot of people have heard of Zeiss. They're sort of known for their optics and cameras and lenses and things. And worldwide, there's you know, hundreds, if not thousands, of doctors using this technology, but we're the only ones in Colorado that have this. In addition, we have 2 operating suites, so we have a total of 4 lasers, 2 for making flaps, 2 for doing the correction. So we really have the all the toys necessary to get the results that we need to.
And to make it as comfortable as possible for the patient. So tell me more about the technology. It was Zeiss that you used on Sember?
Yes, I believe it was.
Okay, and
Yeah.
So how long does the procedure last with a patient?
Well, what's really great is there's 2 parts to the procedure. The first is making this flap, which with the new method is totally painless, right, Sember? And that only lasts for about 15-20 seconds. And then there's the correction part that lasts for about another 20-30 seconds, which you can see here on the video. So the entire time the patient's having the procedure is about 10 or 15 minutes they're in the procedure room. The actual procedures, though, just in a matter of seconds per eye. We have somebody that's there to hold the patient's hand. You can see in that video we numb the eyes just with drops. There's no shots necessary or anything like that, no needles. It's all done with a laser, all done with light. There's no blades, there's no cutting, and we use sterile technique. And the patients get up and can see, Sember, you could see across the room, see a clock. It's a little blurry for a few hours. And then after that, people say by that evening or the next day, their vision's really good. How long ago was your procedure?
It was a month ago. I had it March 3rd.
How cool is it to wake up in the morning, and he mentioned the clock, not fumbling around for a pair of glasses or contacts before you can actually see what time it is.
That has been probably the best part. You can wake up and see a clock. You can see a clock in the middle of the night.
Plus not having to worry about the expense of glasses or contacts.
Exactly, or anything you do activity-wise, camping, anything that you need to bring your glasses or contacts and you don't have to worry about anymore.
So what would you say to viewers who are watching today and they're thinking about maybe getting LASIK done? Why would you encourage them to go to Dr. Dishler?
I would say the first step is not to hesitate and just go get a consultation and see what they tell you. It made me feel 10 times better just to go have them talk to me about it and explain to me the whole procedure. And I would say don't hesitate. It's the best thing I've ever done.
Do it, yes. And Dr. Dishler, thank you. I know you have a great special for our viewers, so I'm going to let them know about it right now.
Thank you.
Yeah, great seeing both of you.
Thank you.
Again, see for yourself why Dr. John Dishler was selected 2 years in a row as one of the leading laser surgeons in America. You'll be in good hands with the Dishler Laser Institute when it comes to LASIK surgery. So if you are one of the first 50 callers to schedule an all-custom LASIK surgery procedure, you are going to save $300 off Dishler's lowest guaranteed price. You're saving $300, and this is a Colorado & Company offer. It's good only until April 21st. 24-month financing is available, so call 303-793-3000. 303-793-3000 to schedule your free LASIK consultation, or visit Dishler.com. And Dr. John Dishler has been recognized as one of the top 10 LASIK surgeons in the country and the most experienced surgeon in Colorado when it comes to the advanced all-laser method. Here's the number one more time for you. It's 303-793-3000 for your free LASIK consultation. And the Dishler Laser Institute paid for this segment.